It's 2022 and high time we expand our definition of what cardio is. High intensity training, HIIT, and our approach to exercise stimulates healthy changes in our heart and cardiovascular system. As a result, we become increasingly protected against heart disease. In this video, we'll talk about the specific research-proven cardiovascular benefits of high-intensity training and what makes this approach so effective. The first thing to note is that strength training is cardio. Strength training stimulates the cardiovascular system to change in several ways, and when performed in the high-intensity training style we use at the Perfect Workout, exercise is even more beneficial for the heart. The first benefit is blood flow. Strength training increases overall blood flow, and this is especially true when pushing to muscle success, the point when you can no longer move the weight on the lifting phase. Pushing to muscle success leads to a bigger increase in overall blood flow. As a result, more oxygen reaches your muscles, which allows the muscles to work harder, which ultimately improves your overall workout performance. Another benefit of performing exercises to the point of muscle success is artery function. This particular improvement manifests in the artery's ability to expand more when blood flow increases. And a heart attack can simply be avoided if the artery can expand enough to let the necessary amount of blood pass through. Therefore, having an artery that can dilate well above its normal size is a significant way to avoid both heart attacks and strokes. Next is the risk factors for heart disease. A person's risk for developing heart disease is most commonly determined by measuring risk factors. And when these risk factors are elevated, a person is more likely to eventually develop heart disease. Strength training helps maintain or improve the following risk factors: hemoglobin A1C, blood pressure, triglycerides, oxidative stress, and inflammation. Our style of HIIT training at the Perfect Workout is especially beneficial for risk factors and blood flow due to the lack of rest between exercises. In studies where exercisers spent less than 30 seconds between exercises, the cardiovascular benefits were greater. And if you've ever trained with us in one of our studios, you know that we move quickly from exercise to exercise. And then there's heart disease mortality. Considering all of the previous stated benefits, it's logical to think that strength training should protect us from heart disease. And research actually confirms this. Long-term strength training reduces the risk of developing and dying from cardiovascular disease. You might be wondering, are there any particular exercises that are the best for heart health? And yeah, there are. The best exercises for maximizing muscle efficiency and ultimately arterial blood flow are compound exercises. These movements target the biggest muscle groups in the body, like the glutes, legs, back, and chest muscles. In theory, you can hit all major muscle groups with just 4 to 5 exercises. The leg press, which targets the glutes, quads, and calves. Chest press, which targets pectorals, shoulders, and triceps. The lat pull down, which targets your lats, your biceps, and your abdominals. And the leg curl, which targets your hamstrings. And then, of course, you can add on any abdominal exercises. The big takeaways here is that strength training is a heart-healthy activity. Performing strength training in the Perfect Workouts method is especially beneficial for cardiovascular health. Pushing to muscle success on each exercise and moving quickly between exercises both provide an additional stimulus to the cardiovascular system. As a whole, through 2 safe yet challenging sessions per week, strength training can improve your blood flow, your endothelial function, and risk factors for heart disease. And as a result, you develop a healthier cardiovascular system and reduce the risk of ever developing heart disease. Learn more at theperfectworkout.com, and there you can schedule a free introductory workout.